We are beginning with Dr. Swati Mohite. Dr. Swati Mohite is from the Bharti Vidyapith College in Pune, and he will speak on the topic of Uttarabasti, an alternative treatment for tubal block induced infertility. Dr. Mohite, please.
Respected dais, my teachers, renowned clinicians around the world. The previous talk was on the similar subject. So I will introduce my work, what we do in India as an Ayurveda gynecologist. There in India, as Ayurveda gynecologist, we are allowed to perform all kinds of surgeries with Ayurveda medical practice. So there the pattern of practice is little bit different, that if a patient conceived after a treatment of tubal block, we conduct all antenatal checkup, we conduct delivery, if necessary we perform cesarean section, and we even manage post-puerperal phase. So this is the practice in India as an Ayurveda gynecologist. Our syllabus is also made in that type that our syllabus contains 60% to 70% Ayurveda and 40% modern medicine. So it is a very good type of practice in India. So since yesterday morning, we are talking on many things, and this session is especially on women health. I would like to take your attention to some parts which has been mentioned in Ayurveda about women health. Right from birth, if the baby is female, the lifestyle of a female child is mentioned different in Ayurveda. Similarly, epochs of life, epochs of woman life has been mentioned in Ayurveda, and there are different types of charya mentioned in Ayurveda. We come across to know dinacharya, rutucharya, many charyas, but as a clinician, I know that there are rajaswala charya, garbhini charya, sutika charya. That means rajaswala charya is nothing but do and don'ts during menstrual cycle. So this is very unique feature. When I treat a cases of polycystic ovarian disease, I found that there are some problems in their lifestyle during 5 days of menses. So that is a unique feature mentioned in Ayurveda. Similarly, the antenatal programming, that means a Garbhini Paricharya, which has been mentioned just 5,000 to 6,000 years back, but now modern people, they are doing antenatal programming. What is antenatal programming? Antenatal programming is a programming during antenatal care for hypertensive patient, gestational diabetic patient, and like that. But for in Ayurveda, it has been mentioned as Garbhini Paricharya. So during antenatal period, the pregnant lady has to follow some rules to have. It has been mentioned that the delivery should be anupaghataya, means without any complication. The pregnancy should be anupaghataya, means pregnancy should be without any complications. So this is the uniqueness of Ayurveda. Even it has been mentioned in Ayurveda that Sutika Paricharya. Sutika Paricharya is nothing but a lifestyle which is to be followed after delivery. In our hospital, we conduct around 100 to 150 deliveries per month. Just 3 months back, I published a research paper that is Ayurvedic management of post-puerperal phase, that is a Sutikavastha. In that phase, I am not at all using any antibiotics after delivery. Even in the patients having episiotomy with vaginal delivery, only Ayurveda medicines, Ayurveda analgesics, Ayurvedic steroidopeptides without antibiotics. So this is the uniqueness of Ayurveda, and this that paper is also very good. It is a paper of 271 patients delivered normally, vaginally, with episiotomy. So this is the uniqueness of Ayurveda we have not discussed since I think yesterday. So my today's topic is Uttarabasti and alternative treatment for tubal block. Already Dr. Patil covered 60% of my presentation. But still, as a gynecologist, I will explain you the procedure, which is very important because everybody emphasized since morning, yesterday morning, that Ayurveda covers external route of administration of drug, that is local massage, oral route of administration of drug, per rectal route of administration of drug, and now I am concentrating on intrauterine route of administration of drug. If you see the references of Uttarabasti from Kashyap Samhita, they are around 4,000 years back. And intrauterine application of medicine has been found by modern medicine in early 19. So see, the Ayurveda science is so advanced since so many years. Now, how Uttarabasti acts? That is, I think, the same inclusion-exclusion criteria like Dr. Anil Patil. But here, I use Sahachar tel oil because it has been mentioned in Ayurveda that kshara are to be preferably avoided on reproductive organs since it may affect the fertility. So I am using Sahachar tel for this administration. Since practicing for last 25 years, I have modified as it has been written in our mail that CDs, videos are not allowed. So I have not put with the video, but I have modified the procedure and we do the procedure in complete aseptic precaution in operation theater. We all know that cervix is not having nervous supply. So it is, if anybody use my method of intrauterine instillation, there will be minimum complications. Because previously we used to put some cannula on the cervix which covers the cannula and that oil goes in the abdomen and there are chances of oil embolism. Just I think 3 years back, there was a case of death after Uttarabasti, and that was because of oil embolism. So I modified the procedure and I used the infant feeding tube. So which is very small size, and if we use in primipara a number of 5 or 6 infant feeding tube, and if for multipara, for secondary infertility, if we use 6 or 7 number of infant feeding tube, there will be less chances of oil embolism or oil going into peritoneum. So this is very important, how to give Uttarabasti, because this is clearly, absolutely an OPD procedure. So, but we just keep the patient at least for 3 years under observation, because sometimes dragging of the uterus for putting that infant feeding tube inside uterus, it may create some colicky pain in lower abdomen. So it is necessary to keep the patient in IPD setup for observation at least for 3 hours. Even I have modified the procedure, like previously complete 2 to 5 cc intrauterine oil has been inserted. But now I have modified the procedure to minimize the complication, like if we put half cc every 15 minutes inside the uterus, then there will be slow absorption of oil, because nowadays it is proved that endometrium has good absorbing capacity, and that's why latest researches we find that intrauterine implantation of insulin and intrauterine implantation of calcium in perimenopausal period, that research is going on nowadays. So now everybody is accepting that intrauterine absorption of medicines is good. So, and we should be very proud that our Samhitas has mentioned this intrauterine application of oil around 5,000 years back. So I will conclude it. with, thank you, thanks a lot. As a gynecologist, we are supposed to give them baby like this. So thank you.
Thank you so much for that contribution and for helping to revive and restore this knowledge to its fullest. Thank you very much.